Dr. Christy Ennis. This video is for you today if, like me, you go just a wee bit stir crazy when you have an injury and you can't work out. And so do all the other people in my life. So this video is for me, for you, and for all of them as well. So specifically dealing with back pain and leg pain, because we're gonna have seated exercises and lying down exercises, focusing on some legs and some arm stuff. So just keep that in mind, that if you have a shoulder or a forearm injury, this may not be the workout for you. Now, because I am dealing with a back injury, I'm going to show you kind of my modifications so that you can hopefully help yourselves too. So we're starting in a seated position, and I'm actually going to take a pillow behind me in my really ugly chair, but just to keep my back supported and comfortable. Where I'm still not overly comfortable, just in general, this really can help out. Also keep in mind, if you are having pain, you're unsure about what to do, please check with your doctor first before starting even these kind of basic exercises, okay? Now, point number 2 that I want to make before we get started is that make sure to have all your equipment next to you so that you don't have to reach around, right? If you have an injury, sometimes it doesn't feel good to do a whole lot of moving like that. So just the closer the stuff is for you, the easier it will be, all right? And then also know that you're probably, not even probably, you are going to use a lot less weight than you normally would. And that's okay, right? The goal here is to get some movement, some endorphins going, and just make you feel at least even a little mentally better. And then lastly, we're using weights and a band. And this gnarly old band, if you can see, I actually was a length of band that is tied, and I love the loop bands. But sometimes it's hard to slip over when you're not feeling well. So I know this one's already tied, but if it wasn't, you would take it around above the knees and then tie it so you wouldn't have to bend a lot to get through it, okay? So keep in mind too, like I said, today's workout, we're trying to keep everything steady and stable. So there's not twisting, there's not bending, so that you can still get a good workout, but not cause any other injury or more pain. Please, I should have said really number 1 before any of this stuff, listen to your body because every body is a little bit different. So let's get started with our Follow Me Friday today. I'm gonna grab, these are the same weight, they're just different colors and totally different shapes. But we're gonna start with a regular bicep curl. So it does help to have a chair that doesn't have arms so that you don't whack it, right? Which is why I have this lovely chair. So we're gonna start with making sure we're comfortable, engage in those deep abdominal muscles. So it's just that little tiny belly button pull in, breathing, and then we're gonna go up for 10 reps. Stop at any time if you have any discomfort. So there's 1, 2, 3, 4, 5, 6, 7, 8, 9, I can't help but move my toes too, and 10. Now keep those elbows in at your side, bring those forearms down a little, and we're gonna come straight out and straight back in, okay? So here's 2. We're gonna come out a little bit and we'll keep things close to our body too because that definitely helps the back also. 4, so nothing overhead today because that tends to put stress on the spine a little bit more. 5, 6, 7, 8, 9, and 10. I'm gonna put these weights together. I'm gonna start, and it's okay if your 8 isn't exactly an 8. This is called a figure 8, but just make the best of an 8 as you can. But we're gonna go over from one side to the other. So notice again, I am trying to keep all of my middle of me nice and steady. I'm not twisting and turning, but I'm using my abs a little bit by keeping that core steady as those arms move. So there's 3, maybe 4, 5, 6, don't lift too high. That's 7, 8, 9, and 10. Okay, here comes a little brain work. We're gonna try to switch directions. I'm terrible at this. 1, I don't think it looks like an 8 anymore. 2, you get the idea. 3, 4, don't hold your breath. 5, 6, 7, 8, 9, and 10. Good. Keep those weights in the center again. We're gonna chop right off to one side. So we'll stick with one side at a time. Same idea, keep that core nice and solid. And moving the arms around it. So here we go. You can move your head too if it feels okay. Again, nice breath. And I'm gonna squeeze a little bit off to the side. For 1, if you get dizzy, don't let your head go with you. Keep it in the center. 2, 3, 4, and if you haven't checked out my locals page, I will link that below for you guys. I have a whole bunch of different videos there that you don't see anywhere else, and I am going to be doing some live streams too, so fun stuff, including classes. There's 8, 9, one more, 10, of course the other side. Now keep in mind, if your injury is off to just one side and it doesn't feel good to go to one side, it's okay for right now. Just listen to that, all right? There's 3, 4, 5. Just enjoy the fact that you're finally getting your body to be able to move and do something. 7, 8, and I'm just following my breathing along with those weights. And I messed up my counting, but we're gonna do one more. There's 10. All right, I'm gonna grab that band. See, notice I don't have to really move a lot to put stuff down and to pick it up. Band is gonna go right around the wrists. If that's uncomfortable, you can move it up a little higher towards the forearms. Squeeze into those shoulder blades. I'm gonna bring one arm out. I'm just gonna turn just a touch. One arm out, and then the other arm is gonna pull straight back so that I'm getting that row. So there's 2, 3, 4, 5, 6, adjust your position at any time too if you need to, 7 to stay comfortable, 8, 9, and 10, and I'm gonna switch, so left arm will go out a little bit, so I have a little resistance to pull back with that right arm for 1, don't forget those shoulder blades, 2, 3, 4, 5, 6. I know I said not to twist, I'm just so you can see me. 7, 8, 9, one more, 10. Keep that band right where it is. You can bring your arms a little lower so there's less stress on those shoulders. Squeeze into those shoulder blades again, and then you're gonna pull that band apart for 1, 2, hello shoulders, 3, 4, they're talking but in a good way, 5, and my back's not talking to me at all, even better, 6, 7, 8, 9, one more, 10. All right. Now again, we're going to take this band and we're going to put it above the knees to start. So either you're going to slip one on or tie it around. I'm actually going to do it without even moving much. I've practiced this move. All right. So again, starting with that band above the knees. If you want it to be a little harder, you move it further down towards those feetsies, okay? But again, staying in your nice position, we're going to pull both of those legs out for 10. So here we go. Here's 1. And again, nothing else is moving but these legs and my hands. 2. It's really hard. 3. I think if you tied my hands behind my back, I wouldn't be able to talk. 4. 5. 6. 7. 8. 9. One more. 10. Now, very slowly and easily, you're just gonna kind of whoop, let that slide down. See, I don't have to bend at all to even do that. So now that it's around those ankles, we're gonna take that left leg and I'm gonna kick straight out, hopefully without the band snapping, to get that quad muscle. So here's 2, and again, make sure none of this hurts, right? 3, you may find that some of these exercises are awesome and some don't feel so good, and that is totally okay. 4, go with the ones that feel good. 5, Really think about squeeze a little extra as you come out. 6, but don't change your back position. 7, you can even do these with a cast on. Been there, done that. 8, 9, and 10. Good. Switching sides. 1, 2, 3, 4, 5, 6, 7, 8, 9, one more, and 10. Okay, I'm gonna bring my right foot forward just a touch, and then I'm gonna pull back with this left leg to get now the opposite muscle, those hamstring muscles. And you may need to move your foot even further forward than me to get more resistance. That's how you get more resistance, just move that opposite foot forward a little bit more. There's 3, that was a mouthful. 4, 5, 6, it's not no pain, no gain, keep that in mind. 7, 8, 9, one more on this side, 10, and I'm gonna switch other side. Here we go. Pull it back for 1, 2. So this helps a little bit too because you've got the other leg to ground you. Sometimes that just little extra stability really helps. There's 5, maybe, 6, I'm trying, 7, 8, women are supposed to be great at multitasking. I am not. 9, and 10. All right, we've got one more. I'm going to take my trusty pillow because I forgot to put another one there. Even though I told you guys to be well prepared, I clearly wasn't. But just again, make sure that your back is supported. This is quick, so we're just gonna take that pillow and we're gonna squeeze in without holding your breath and let it go, right? Getting those inner thighs a little bit of work. So there's 2, 3, 4, 5, 6, 7, 8, 2 more, 9, and 10. Yeah, now we're gonna do some stuff right on the bed. All right, our second group of exercises are lying down. So if you can do both seated and lying down, awesome. If you can't, it's okay to do one or the other, but you do need your pretty weights again. And we're gonna start with our arms right overhead. And notice that my legs are bent up. That's to help support my back. You can always put a pillow underneath there too if that's more comfortable for you. We're gonna get those triceps though. So the upper arm is gonna stay right where it is and only the forearm is gonna bend at the elbow. So here we go. The weights come back towards our head, which is why it's called a skull crusher. I did not come up with that name, but it's kind of fun. There's 2, 3, 4, 5, you should feel this in the back of the arm. 6, 7, 8, 9, one more, and 10. Okay, arms are going to stay straight and I'm gonna alternate bringing one arm back and then the other one, so 20 total for this one. So starting with that left arm for me, I'm gonna come back and right back to the center. Now for this one, make sure that you're only going as far back as you can without arching into the spine or the rib cage, right? Everything is staying nice and steady except for those arms. So there's 4, 5, and we do have to use those abs to stabilize a little bit, but it should be pretty comfortable. 7, 8, 9, excuse me, 10, 10, 9, 8, 7, 6, little less pressure going through the spine when our arms are overhead like this versus when we're seated. One more on each side here. Okay, I'm gonna bring my arms back down by my side. For this next one, we're gonna get a hammer curl, so our wrists are gonna stay in this position. Now granted, we can't bring our arms all the way down, so you don't obviously get the full range of motion, but this is great to do, especially if you couldn't do the ones seated. You get a little bicep work still too. So bringing those hands towards those shoulders and back down for 1. Don't hit your shoulder. 2. Remember, no injuries. 3. 4. This is about feeling good today. 5. 6, 7, 8, 9, one more, 10. Okay, we've got one more exercise to do, and I'm gonna put the weights down right by me. Don't let them crash onto the floor. We're gonna straighten out one leg, but keep the other one bent to give support again to that spine. I'm gonna think about tightening up the quad muscle by squeezing it together. So press that kneecap down towards the mat. Hold that, and then I'm gonna lift that leg a little. At the same time, I'm actually gonna press down into the mat, just gently, to give a little extra stability and support. This is another one you can do with a cast on or a boot on or a splint on. It's a good thing I'm accident prone, so I can test all these things out for you guys. Here's number 5. 6, only lifting as high as you can. You don't need to lift real high. 7, 8, and if this one bothers you, please don't do it. That goes with any of them, certainly. 9 and 10, and then switch to that other leg. Squeeze that quad, lift that leg for 1. 2, of course, breathing. We all need those little reminders. 3, 4, one side may move better than the other. 5, 6, abs still working here too. 7, 8, 2 more. 9 and 10. Awesome, you did it.